Hello everyone. I hope I'm clearly visible and audible. Yes? Let me check. If I'm clearly visible, audible, I will start ahead. Give me a minute to check. Okay. I hope it is working. Just a second. Yes, it is working. So I hope you can see me, you can hear me, you can give me a thumbs up in the chat box if I'm clearly visible and audible to you people. I welcome you all for this session also. I am Dr. Priyanka here, educator on Unacademy, and this is the second YouTube live session today. So in the first lecture, we have started pharmacodynamics. We have already started pharmacodynamics, and in the pharmacodynamics, we have started DRC, dose response curve. So all those students who are old students, they already know what is DRC, and we were studying the significance of DRC. So 4 parameters are important in DRC. Out of the 4, we have discussed the 2 in the last lecture. So give me a minute and let me jump on the slide where we were and let me continue from the rest of the 2 parameters. Are you people there? Should I continue? Yes. So give me a minute. Just a minute. Here I am. So uh, we have 4 parameters in DRC. So let me summarize for the one who are the newcomer. In the DRC, we have seen we draw a graph, DRC. What is the full form of DRC? Dose response curve. So it is a curve. Curve means graph. Graph have x-axis, graph has y-axis. So we are having 2 axes on the graph. So on x-axis, we take dose. We take dose, actually logarithm of the dose, not dose, log dose. So dose, and on y-axis, we take response. On y-axis, we take response of that dose of that drug. So dose response curve. Actually, it is not DRC, it is log DRC. It is logarithm of the dose response curve. So actual name is log DRC. We have already started it. Log DRC, logarithm of the dose. So instead of dose, we are taking logarithm of the dose and we are taking response here. So once we plot the graph of any particular drug here, we get a sigmoid shape. We have studied this, that we get sigmoid shape. This is the sigmoid shape graph we get. Okay, you already know why we get that sigmoid shape graph. So let me draw the 2 graph just to compare it. So if we take dose and response, and if we take logarithm of the dose and response, what is the difference between the two? Okay, let me talk about the first graph. So just suppose we are taking 10 milligram of the drug, 20 milligram, 30 milligram, 40 milligram, 50 milligram, 60 milligram. So when we take 10 milligram of the drug, it is producing 10% response. When we take 20 milligram of the drug, it is producing 20% of the response. 30 milligram, 30%, 40 milligram. So we increase the dose, more responses produced. So if I'm having headache, I'm taking only 10 milligram of analgesic, a little bit is reduced. 10% is treated, but 90% is still there. I'm taking 20, so 20% is treated, 80 is still there. So likewise, I'm increasing the dose. So response is the treatment of that disease, that test response. So I'm increasing the dose, response is increasing. So increasing the dose increases the response up to a certain point. After that, it becomes constant. So it is increasing, but after that 30, 40, 50, 60, whatever milligram you are taking, the response is only 40%. So maximum response the drug can give is 40%. So this shape of the graph, you can see the shape of the graph here. It is known as hyperbola. Now doing calculations in hyperbola is extremely difficult, so we converted the strategy. So instead of dose, we use logarithm of the dose and we take the response. So here we will get the shape of the graph is sigmoid. So here shape of the graph is sigmoid. So we use this curve, sigmoid curve. Now here we use 4 parameters: potency, efficacy, slope, and therapeutic index and therapeutic range. In the last lecture, we have already studied potency and efficacy. Yes or no? We have studied. You were there. Everyone was there. So we have studied the potency and we have studied the efficacy of the 2 drugs. This is log dose and this is response. So log dose response curve may we have seen, just suppose these are the 2 drugs. This is drug A and this is drug B. So how potency is compared? Potency is the amount of drug needed to produce a particular response. So decide a response. Just suppose I need 40% of the response. So this 40% of the response, drug A is needed in this dose and drug B is needed. So the drug which is required in less dose is more potent. So A is more potent than B, potency wise. So the drug which is on the left side is more potent as compared by the drug which is present on right side. This is the summary of potency, and potency is measured on x-axis because it is the amount of drug which is needed to produce a particular response. Let me talk about efficacy. Efficacy is the maximum response produced by the drug. So A is producing 80% and B is producing 50% of the response. You can see. So A is more efficacious than B. It is the maximum response which the drug can produce, right? So taller the graph, more efficacious it is measured on y-axis. So we have already, yes, height, Vasant, very good height. So we see two criteria, left right criteria based for potency and tall and short criteria based for efficacy, right? So we have already seen this. Let me come on the third criteria slope. And out of this, clinically more important criteria is efficacy, right? If you have a drug which is more potent than B, if you have the same comparison in efficacy, B is more efficacious than A. So what you will prefer in your patient? In your patient, you will prefer B because B is more efficacious. Efficacy is more important deciding factor as compared to potency. We have seen all this. Everyone give me a thumbs up. That was the revision of the last lecture. So let me come on the third criteria, slope. You have to compare the slope of various drugs. What do you mean by slope? Everyone give me a thumbs up. Let me see if I can see your chat, yes or no. So let me start. Just a second. So let me compare the slope. Okay, let me compare the slope of the two drugs. Now, first you have to understand what do you mean by slope. The drugs have two types of the slope. Okay, I will draw it for you. I would like to draw a graph for you. Okay, so see here what I am drawing. I'm trying hard. So on x-axis, always take dose of logarithm of the dose. On y-axis, always take the response. Now there are two drugs. Just suppose this is drug A. This is the graph. This is the graph. Drug A, this is the graph. It is sigmoid. And drug B, this is the graph. Okay, just a second. This is the graph for drug B. This is drug A, this is drug B. Both are sigmoid. These are the graphs. So what is the difference between them? Just suppose, let's talk about drug A first. So drug A, whenever I am giving, these are the doses. So whenever I am giving at 10 milligram, this is the response. You can see this is the response. It is 10%. Whenever I am increasing, doubling the dose at 20 also, the response is instead of 10, it is just 11 or 10 only. Hardly the response is changing. So on 30 also, hardly the response is changing. It is 10, 11, 12%. Hardly it is changing. I'm increasing the dose, I'm increasing the dose, I'm increasing the dose. But response hardly changes. So this is known as flat slope. The slope of this drug is flat because on increasing the dose, response hardly change. So I am increasing the dose abruptly, but response is changing very minimally. So these are known as safe drugs. You can understand now. I am giving 10 milligrams, so 10% of the response is produced. By mistake, instead of 10 milligram, patient has taken a tablet of 20 milligram. What will happen to the patient? Nothing. 10 की जगह 11% response मिलेगा या 10 ही मिलेगा. So these drugs are safe. Instead of 20, if the patient is taking 30, 40, 50 by mistake, so nothing will happen to the patient. There is no toxicity. Patient will not die. No side effects because hardly any change in response is there. So these drugs have flat slope. This slope is known as flat slope and these are safe drugs. Give me a thumbs up. Give me a thumbs up. Let me told you the other way round. See the slope of the drug B. See the slope of drug B. In drug B, if I am taking 10 milligram of drug B, this is the response. And if I am taking 20 milligram of drug B, this is the response. So initially response was 20% and now response is 70%. I'm increasing the dose a little bit instead of 10 to 20 by mistake patient has taken. So response suddenly increases. So this slope is known as steep slope. This is known as steep slope and these drugs are dangerous. You cannot casually say the patient, okay, dose double kar do. No, you cannot. You have to think twice. So if you are giving any drug, okay, you have this disease, please take this drug, go home and take this drug. So patient is taking the drug and he's calling you, doctor, I'm not getting any response. The disease is same. Should I increase the dose? So you have to check whether the drug you have prescribed to the patient is having which slope. If it is flat slope or steep slope. If it is steep, you cannot casually say, okay, double the dose. If the patient has double the dose, there is drastic increase in response. So sometimes it can be harmful. It can cause toxicity. It can cause death also. And if it is flat slope, the patient can easily increase the dose. Give me a thumbs up. So there are two types of drug in the world. Some drug have flat slope and some drug have steep slope. The drugs which have flat slope are safe and the drugs which have steep slope are dangerous. Give me a thumbs up. So the slope wise, the drug is of two types. So you always have to consider the slope of the drugs for that particular disease. Okay, let me take one more example which is given in KTT. So there are two slopes you understood, steep slope and flat slope. What's the definition of them? Steep का क्या definition है? Who will tell me the definition of steep? A little increase in dose increases the response drastically. That is steep. That is steep. So dose needs to be individualized for each individual. Flat, a little increase in response with wide range of the dose. You are increasing the dose from 10, 20, 30, 40, 50. Hardly increase in response. So response increases very little. So that is flat. So in steep and in flat, you can write like this. So there are two types of slope, steep and flat. You can write like this. So here you increase the dose, here also, here also. What will happen in response? What will happen in response? So in response, if it is steep, response increases drastically if you increase a little bit dose. But here in flat, response does not change or hardly change if you increase the dose. So that is the summary. These are dangerous. So needs individualization of the dose, and these are safe. So here the dose is safe and it is same in all individual. Whether a 60-year male, a 20-year male is coming to me, male, female, I will give the same dose because it is flat. But here I will consider the doses because a steep curve is there. So these are dangerous. Have you got it? This is the definition. Let me give you an example which is given in KDT, right? So this is the example given in KDT. Very good example. There are two drugs available for hypertension. You know what is hypertension? The patient is having blood pressure more than 120/80. So I have given a drug to the patient. I am having two options, hydrolazine and hydrochlorothiazide. Both are anti-hypertensive drugs. Both are used to control hypertension. So both will cause fall in BP. What is the response here? The response is fall in BP. Both of them will cause fall in BP at a particular dose. But you can see the curves of the two. The blue is the curve for hydrochlorothiazide and yellow is the curve for hydrolazine. You can see the curve. So you can see here, let me talk about the blue one, that is hydrochlorothiazide. I am increasing the dose. So 10 milligram, 20 milligram, 30 milligram, 40 milligram, but hardly change in response. Response is almost same. Hardly, a little bit change, a little bit, very little bit change in the responses there. Right, have you got it? So this is a safe antihypertensive. This is safe. On the other way round, see hydrolazine, okay? So here you are using 10 milligram, this is the response. On 20, see the response. On 30, see the response. So wide range in responses there. So here, instead of 10 milligram, at 10 milligram blood pressure is controlled. Fall in BP is 20 mm. So patient BP is 140/90. तो ये 20 से reduce हो गया, 20 से reduce हो गया, 120/80 हो गया. So patient is normalized. But instead of 10 milligram, if the patient is taking 20 milligram, the fall in BP will be 40 mm. तो ये 40 mm से कम होके patient's BP हो जाएगा 100 by और कम हो जाएगा 60. Have you got it? Have you got it? So patient can go in shock. Patient go in hypotension. So this can be dangerous for the patient. Have you got it? Give me a thumbs up if you got it. Have you got it? Efficacy is high for steep. No, Kuldeep. There is no relation between potency, efficacy and slope. I am not relating slope with potency and efficacy. No, it is not the conclusion you are giving. Kuldeep is asking, is efficacy is high for the steep? No, it is not the case. Efficacy is more for the flat. No, efficacy wise, don't compare it. These are various parameters. Don't try to mix them. So slope wise, learn there are two types of slope, that is slope, steep slope and flat slope. Now don't compare them with efficacy wise, and don't compare them with, it is not efficacy, Kuldeep. Okay, let me draw a graph for you. So, okay, so this is the graph 1 for drug A, and this is the graph 2 for B. So here this one is flat, but it is more efficacious. You are saying flat efficacy is high for steep. No, here for flat it is high. So don't relate. Anything can happen. Anything can happen. So here for looking at the slope, you have to compare by increase in dose, how much increase in the response. That is the definition. If you are increasing a dose by little bit and response is changing drastically, it is steep. And if you are increasing the dose, there is no change in response or hardly any change in response, it is flat. So don't compare them with potency and efficacy. There is no conclusion in any book. So you are not authorized to make any conclusion here. These are various criteria. Don't mix them. Give me a thumbs up if you got it. Everyone, anything can happen. What you are saying, Kuldeep, Pranali, reverse can also happen. So both of you are not true. So don't compare the slope with either potency or efficacy. There is no conclusion. So there is not only not I am giving, it is not, there is no nothing given in the book. Anything can happen. So a flat slope can have high efficacy also, low efficacy also. And a steep slope can have also high efficacy, low efficacy, and potency wise also anything can happen. So you cannot give a firm conclusion, right? There is no rule. Coming on the last criteria, everyone give me a thumbs up. That is therapeutic index and therapeutic range. These are two different things. So first let me talk about therapeutic index. बाद में आते हैं therapeutic range पे. Therapeutic index first we will understand, then we will come on the fifth and the last one, therapeutic range. So these are two different things. Very few students know that these two are different. So let me talk about therapeutic index. The other name of therapeutic index is safety margin. So therapeutic index is known as safety margin. Okay, listen. Can you see this is a graph? On the graph, can you see two DRC? This is first DRC and this is second DRC. These are not two separate drugs. This is the same drug A, drug A. You will say, ma'am, why then there are two DRC? Why then there are two DRC? One DRC is effect of the drug. One DRC is adverse effect of the drug. One is effect, one is therapeutic effect of the drug. One is adverse effect of the same drug. It is the same drug. It is the same. It is not two separate drugs. Please understand this concept first. Let me draw. So this is a DRC. Let me take drug A. If I take the therapeutic doses of that drug, any drug, so this is the DRC. If I draw, this is the DRC. If I take toxic doses of the same drug, this is the DRC. So this is the same drug, drug A, drug A. This is the therapeutic doses, this is the DRC, and adverse effect का DRC ये है. ये therapeutic effect का DRC है और वो adverse effect का DRC है. Give me a thumbs up. Now the gap between them, the gap between the two DRC will give you the value of therapeutic index or safety margin. I want this gap to be more. I want this gap to be more. Listen. First understand. Don't mug up the things. Understand the things. That is, take this is 0, this is 10, this is 20, this is 30, this is 40, this is 50. Just suppose. So at 20 milligram, this is giving the therapeutic effect. Right? What is response? What is given is therapeutic at 20 milligram. But at 40 milligram, it becomes toxic. It is giving adverse effect. Adverse effect का percentage response यहाँ आएगा. So at 40. So the gap between 20 and 40, ये जितना ज़्यादा होगा उतना अच्छा है. So there is no confusion to the patient. So by mistake, instead of patient taking 20, patient has taken 30 also, he is safe. But patient has taken 40, so he is in trouble now. He is in trouble because instead of effect, there is side effect. There is hyperdosing, right? Toxicity हो जाएगी patient को और adverse effect आ जाएंगे. Give me a thumbs up. So I want this gap to be more. More is this gap, safe is the drug. Less is this gap, dangerous is the drug. Dangerous. Just suppose margin is very narrow. Just suppose margin is very, very narrow. So you are in trouble. Like instead of 2 milligram, you cannot give 4 milligram. You have to range between 2 and 4. So you have a very narrow margin for working. So that is known as therapeutic effect. You got it? So therapeutic index or safety margin, you have to draw two DRC. One is the therapeutic effect DRC. One is the adverse effect DRC of the same drug. It is not two different drugs like in potency, efficacy, slope. We were taking different drug. Drug A, drug B, drug C, drug D. No, these are not different drugs. This is same drug. Same drug के two graphs I am drawing. One graph, one DRC is effectivity, that is effective dose, therapeutic dose, and one DRC is adverse effect, the doses at which adverse effect. So you can see the two DRC, right? You see 50% response. This is 0% response. This is 50%. This is 100% response. So the response at which 50% effect is coming, this is known as ED50. This dose. So at 10 milligram, 50% effect is coming. So this is known as effective dose 50. This 10 milligram. And the dose at which 50% adverse effect is coming, that is known as LD, lethal dose 50. Lethal. So effective dose 50 or lethal dose 50. Here 10 milligram is the ED50. 40 milligram is the LD50 in this particular example. Give me a thumbs up. Everyone give me a thumbs up. So what is the formula of therapeutic index? It is LD50 upon ED50. Apply this formula here. It is 40 by 10. So it is 4. It is 4. What do you mean by 4? What do you mean by 4? 4 is the meaning if you increase the therapeutic dose 4 times, patient will die. So 4 times तक का margin है. Instead of 10, you can do 20, you can do 30. But if you have done 40, patient can die. 50% of the patient will die. Give me a thumbs up. That's why it is known as lethal dose 50. Give me a thumbs up. So up to 4 times you are safe. So more is this value, safer you are. Less is this value, in danger you are. Give me a thumbs up. It is the liability of the doctor, the treating physician, the practitioner who is giving drug to the patient. Whatever dose you will write, patient will take the drug in that dose. So you should know the particular dose. What is the dose for the particular drugs? So you should know these two graphs for all drugs. You are prescribing any drug. So before prescribing that drug, you should see the graph. Two DRC, the effective DRC and adverse effect DRC. You should see the gap between them. So some will have very narrow gap. So they are dangerous drug. So inform the patient that this drug I am prescribing, you have to take at this dose only. If you are increasing the dose by your wish, it will not be my liability. You can die. So it is a dangerous drug. So I am writing here 10 milligram. Don't make 11, 12, 13, 14, nothing. 10 means 10. You have to take at that particular dose only because this drug is having very narrow therapeutic margin and these are dangerous drugs. So you have to inform the patient. Sometimes, patients are not medicos. They don't understand. They use their own brains in their own way, simplified way, right? So they see doctor has written 10 milligram. Okay, 10 milligram I have taken. अरे कुछ हुआ नहीं, take one more tablet. Doctor तो ऐसे ही लिखता है. So take one more, instead of 10 he is taking 20. So he is not informing you. So sometimes this happens. So you have to warn the patient. You can do it with this some drugs, but with other drugs it is contraindicated. You cannot increase the dose. You cannot afford increasing the dose because it will cause toxic effect and the patient can die. Give me a thumbs up. So the drugs which is having more therapeutic index, they are safe. But the drugs having less therapeutic index, you have to warn the patient before writing the drug, before prescribing the drug, that don't increases the dose by your wish. Before that, ask me. Otherwise, it's not my liability if you are dying. So that you have to warn your patient, because many patients do this. They use they always relate that dose is directly proportional to the response. They do not know these slopes and curves. They have not done the study, right? But we are the doctors, we have studied all these now. It is not always direct relation ki you are taking 10 milligram, this is the response, you are taking 20 milligram, this is the response. It is not always directly proportional. But layman uses a simple concept, it is always directly proportional. Doctor is taking 10 milligram, so आधा headache तो ठीक हो गया, ठीक है 10 का 20 ले लो, अब बार बार क्या फोन करके पूछना. So they use their own brains. So no, they cannot do that. They cannot afford doing that. They should not do that. But you cannot warn your each and every patient now. So don't increase the dose without asking me. Don't increase the dose without asking me. But for the drugs which are having narrow therapeutic index, these are the dangerous drugs. I will give you the list of that drugs. So before prescribing those drugs to your patient, warn them that they should not increase the dose by their own wish. They cannot manipulate the dose. That you have to inform them. Give me a thumbs up. Give me a thumbs up. So what is therapeutic index or safety margin? It is the gap between two DRCs. So let me summarize. What is therapeutic index or safety index? So the definition says it is the gap between two DRCs for the same drug. Take a drug and make two DRC. One therapeutic effect DRC and one adverse effect DRC. So make two DRC. Therapeutic effect DRC and adverse effect DRC, and the gap between them will give you the value of therapeutic index or safety index. What is the formula? What is the formula? So in therapeutic effect DRC, at the dose at which 50% of the patient are treated, and in adverse effect DRC, at the dose at which 50% of the patient are killed, take that dose, and the ratio of that dose is therapeutic index. So the formula is LD50 is the numerator, please learn, and ED50 is the denominator. What is LD50 and ED50? Lethal dose 50 and effective dose 50. Lethal dose 50 is the amount of drug at which 50% of the animals are dying at that dose. So if you are giving 40 milligram of the drug, 50% of the patient will die. It is toxic. They can die. And effective 50 dose is the dose at which 50% of the patient are having effectivity, right? So 10 milligrams. So 40 by 10 here, answer is 4. So more is the value, safer is the drug. Just suppose instead of 40, it is only 20. So what is the answer? Here, if you increase the dose, double only, patient will die. Here 4 is the answer. So you are 4 times quadrupling the dose, then patient is dying. So dangerous कौन सा हुआ? Doubling पे dry हो रहा है कि quadrupling पे? So quadruple पे you have more margin ना? Doubling पे you don't have margin. Have you got it? So no, Pranali, it is not ED50 by LD50. You are wrong. It is LD50 by ED50. See the numerator, see the denominator. Again I am repeating. Pranali, again I am repeating. It is LD50 by ED50. See the numerator is LD and denominator is ED. How you will learn it? You have to learn it anyhow. So that is lethal dose 50 and effective dose 50. So what is the definition of lethal and effective dose? Effective dose 50 is the dose at which 50% response is produced in 50% of the animals. And lethal dose 50 is the dose at which 50% of the animals are dying. Death is occurring. So take the ratio of LD upon ED. So 40 upon 10 na. So that will be 4. It is not 10 upon 40. Give me a thumbs up, everyone. So this is the graph. You got it? That is therapeutic index. That is the therapeutic index. It is the measure of safety of a drug. So drugs having high therapeutic index are safe, and the drugs having low therapeutic index are toxic. They are dangerous. This is the summary. Give me a thumbs up. So we are done with therapeutic index. So the definition is gap between two DRCs. Which two DRCs? Therapeutic effect DRC and adverse effect DRC. That is the gap. And formula is LD50 upon ED50. And the summary is that more is the value of therapeutic index, safer is the drug, less is the value of therapeutic index, dangerous is the drug. Do you have any doubt in this, even the slightest one? If not, give me a thumbs up so I can move on therapeutic range. Everyone give me a thumbs up. So therapeutic range is somewhat different than therapeutic index. How? Let me come on therapeutic range. Learn the another name. It is therapeutic window. Learn one name for both of them. Therapeutic index is known as safety margin, and therapeutic range is known as therapeutic window. So learn other name. So again, here I will draw two DRC. Okay. The same two DRC I will draw again. So you will say, ma'am, what is the difference then? Okay, let me draw it. I will explain you. I will try to explain you. These things are very difficult, but I am trying to super simplifying these concepts for you. So let me take the dose, the logarithm of the dose on x-axis. Let me take the response on the y-axis as usual. I'm talking about the same drug. This is the DRC. This is the DRC. Okay. So this is the therapeutic effect DRC of the drug, and this is the adverse effect DRC of the drug. Give me a thumbs up. Everyone give me a thumbs up. So what do you want? What dose range you can afford in your patient? तुम्हारे patient में क्या minimum dose and maximum dose you can afford being a doctor? You will say ma'am minimum dose. If you talk about minimum dose, at least minimum therapeutic effect तो देना चाहिए ना. इतना तो दे, इतना पूरा 100% नहीं दे. If I'm giving a tablet to my patient, patient is having severe headache, at least 50% reduction. उससे कम तो फिर क्या? So at least minimum, what is minimum therapeutic dose? That is the dose I can afford here. Or maximum, the maximum affordable tolerable. Now maximum dose will cause adverse effect. But the maximum tolerable, some adverse effects can be tolerated, some cannot be tolerated, right? So if you say ki ma'am maximum to most, the last adverse effect is the death. Last, you cannot move till death. You cannot want to kill your patient. Now listen, whatever drug you will give to the patient, now it will cause effect also, side effect also. There is no drug in this world which do not cause side effect. So along with the effect, you have to afford the side effect, right? So you cannot see every patient this thing. Now this is a rule in pharmacology. You are giving any drug, drug will cause a good thing, which is the effect. Drug is causing a unwanted thing, which is known as side effect, right? So all drugs have side effect. Now you have to weigh. If the effect is more as compared to side effect, you will give the drug. If the side effect is more than the effect of the drug, you have to withdraw the drug and try another one, right? So being a doctor, you have to judgmental and you have always weigh between effect and side effect. Now there is a drug. What minimum dose you can give? At least minimum effect to I. Otherwise there is no use of giving it. If I am giving any drug to my patient, at least minimum effect hona chahiye, right? That is the minimum dose I can give you. At 10 milligram minimum effect come, below 10 no effect come. So 10 milligram is my minimum dose. I cannot give the drug below 10 milligram. 2 milligram, 3 milligram, 5 milligram. No, there will be no effect. So what is the use of giving? So minimum effect come at 10 milligram, not maximum, minimum. And what is the maximum dose I can afford in the patient? So maximum, when I increase the dose, side effect will also increase. But till maximum dose, death will occur. I cannot afford death in my patient. Yeah, come on, I'm a doctor. I cannot kill my patient. So maximum tolerable side effects I can afford. Tell that dose I can afford. So that may be just suppose 40 milligram, 50 milligram. So 10 milligram is the dose at which minimum effect is coming. And 40 milligram is the dose at which maximum tolerable side effects are coming. So my range of working is 10 to 40. So in various patients, I will give various doses 10, 20, 30, 40. But not less than 10, not more than 40. So that is my range. That's why known as therapeutic range. So 10 is the dose at which minimum effect are coming. And 40 is the dose at which maximum tolerable side effects are coming. Have you got the word maximum tolerable? It is not maximum side effect. It is maximum tolerable. I can afford maximum tolerable only. Maximum side effect, if you say, it will be the death. The last side effect, adverse effect of any drug is the death. All drugs can cause death. If you take it at dose, at any dose, if you take it at very high dose, they can cause death. So you cannot afford that. Give me a thumbs up if you got it. So what I am telling you here is this. So the dose which produce minimum therapeutic effect and the dose which produce maximum tolerable side effect. The range, the range between them is known as therapeutic range. So as I have given you, so you can see the two graphs here. So first graph is the blue color graph. This is the DRC for therapeutic effect. The second graph, the red color graph you can see here is the DRC for adverse effect. So on therapeutic, see, this is the minimum dose which is producing minimum therapeutic effect. On adverse effect, this is the maximum acceptable side effect. This is minimum therapeutic effect. So this range will work. So just suppose it is 10 milligram, it is 40. So you have to adjust your doses between 10 to 40. It is not 40 upon 10. It is between 10 to 40 you have to adjust. Give me a thumbs up. So the drugs which have low therapeutic window, their plasma concentration, okay, this is known as TDM. Have you got it? Have you got both the terms? So let me summarize both the terms. Let me summarize both the terms. The summary I am telling you, those who have confusion, please listen carefully. So take logarithm of the dose on x-axis, take response on the y-axis, draw two curves. This is curve 1 This is curve 2. The first curve is therapeutic effect curve of the same drug. The second curve is adverse effect of the same drug. Adverse effect. The two curves of drug A. This is also drug A. This is also drug A. Both are same drug in front of you. Now I will teach you two things here. One is therapeutic index. One is therapeutic range. Therapeutic index is known as safety margin. Therapeutic range is known as therapeutic window, therapeutic range or therapeutic window. So the two things will be calculated from here only. Let me talk about the first one, therapeutic index or therapeutic safety margin. So here you take 50-50, 50% here and 50% here. The 50% response you are fixing, right? So 50% effectivity, the dose at which 50% effectivity, just suppose 10 milligram, and the dose at which 50% adverse effect, lethal dose, LD50, that is 40 milligram. In our example, it was 10 and 40. It can be anything. So the ratio between the two, that is LD50 upon ED50, is the answer of therapeutic index. Give me a thumbs up. Here we are taking 50-50. Listen, please understand. We are taking 50-50. But let me talk about the second thing. Second thing is therapeutic range or therapeutic window. Here we are not taking 50-50. On therapeutic index, on therapeutic graph, DRC, we are taking minimum effect. And on adverse effect, we are taking maximum acceptable or maximum tolerable effect. So it is the difference between minimum and maximum, not 50-50. That is known as therapeutic range. I really tried hard here. Come on. No one will explain you both things in the same graph with this clarity. So therapeutic index is 50-50% of both, right? And therapeutic range is on therapeutic effect, it is the minimum dose. And on adverse effect, it is the maximum dose. It is not the ratio, it is the range between them. The first one is the ratio, the second one is the range. Give me a thumbs up. Give me a thumbs up. I tried hard. Now, both the things indicate the same thing, that is safety. In both things, whether you take safety index or you take therapeutic window, whatever you take, in both of them, lower the value, the drug is dangerous. Higher the value, the drug is safe. Now, tell me the list of the drug. These are the list of the drug which require therapeutic dose monitoring. What do you mean by therapeutic dose monitoring? These are dangerous drugs. They have very narrow or low therapeutic index also and therapeutic range also. So they have arrows. So these are dangerous drugs. So I have a mnemonic for it. The mnemonic is a drug possessing low therapeutic index. This is the mnemonic. A stands for aminoglycoside. It is an antibiotic. All mycin, gentamicin, there are many mycin, right? Amikacin, streptomycin, all aminoglycosides are very dangerous drugs, right? Number two, drug called D stands for digitalis, right? Digitalis is an inotropic drug to increase the contractility of the heart, right? Again, it is a very dangerous drug. P, possessing, stands for phenytoin. It is an anti-epileptic drug. It is also very dangerous. Loca L stands for lithium. Lithium is used. It is a drug of choice for bipolar disorder. Sometimes the patient is in depression. Sometimes the patient is in mania. That is bipolar disorder ka drug of choice is lithium, right? So it is also a dangerous drug. Therapeutic T, it stands for tricyclic antidepressant. It is a type of antidepressant. And index ka I stands for immunomodulators. So please learn the full form. These all are dangerous drug because they have very narrow therapeutic index. Have you got it? So therapeutic index may be 10 to 15. So you cannot reduce the dose below 10. You cannot increase the dose above 15. So you have a very narrow range of working. Between 10 to 15 milligram you have to work. So if you are prescribing 10 milligram, ask your patient to take that dose only. Do not increase the dose by their own wish. They can die. Give me a thumbs up if you got it. Everyone give me a thumbs up. So for these drugs, you have to do the monitoring. How you will do the monitoring? How you will do the monitoring? Just suppose there are two patients in front of me. This is first patient. This is the GIT of the first patient, right? And this is second patient. This is the GIT of the second patient, right? You are giving one of the drug. Just suppose you are both are having a heart failure. So you want to give digitalis to this patient also and you want to give digitalis to this patient also. Now digitalis is a drug with low therapeutic index, right? This is the blood vessel of the two persons, right? So I want to explain you something. So this patient has also taken digitalis. You can see digitalis and it is absorbed. It is absorbed and going in the blood, right? This patient also taken digitalis and it is absorbed and going in the blood. But absorption of the two patient can vary, na? Bioavailability of the two drugs can vary. So what amount actually reaching the blood, that matters. It is not the thing you are giving 10 milligram here also, 10 milligram here also. So all 10 will reach here. No, absorption can differ. Bioavailability can differ. There are various factors which are responsible here. The pH, we all know the various factors. The food in the stomach, the other substances. So what amount reaching the blood, that will decide the therapeutic index. That will decide the therapeutic window. Give me a thumbs up. So blood concentration is important. What dose you are administering is not important. Actually, what is reaching the blood, that is important. That can vary. If you are giving same dose to both patient, 10 milligram here, 10 milligram here, still the dose reaching in the blood can differ. So what I can do? I am a doctor. How I will judge? Now I know this is a dangerous drugs. I'm giving 10 milligram to this patient also, 10 milligram to this patient also. In one patient absorption is more, in one patient absorption is less. So in the blood here the concentration is more, in the blood here the concentration is less. So how I will know that which patient is in danger? It is a drug with no low therapeutic index now. So I can take the blood sample of both of them in a test tube out of the body, take in the test tube and measure the amount of drug concentration here. Amount of drug, the laboratory will do that, right? So we do this for certain drugs. So this is the list of the drugs here. This process is known as therapeutic dose monitoring. What it is known as? Therapeutic dose monitoring. What do? You take the blood sample out and measure the amount of drug, concentration of drug present in plasma. So we do it for certain drugs. So whenever you are prescribing any of these drugs to your patient, ask them that after taking the drug, the next day they have to give a blood sample in the laboratory and ask the laboratory people to do the concentration of the drug, the test for the concentration of the drug in the blood. So every alternate day or every week they have to do this test. So up to now they are on these drugs, they have to do therapeutic dose monitoring. Give me a thumbs up. So that is the plasma concentration of the drug we are measuring. Plasma concentration is monitored regularly. Now every day to nahi kar sakte, every week or every month we do that, right? Every day we cannot give the blood sample. So TDM is required for these drugs which have low therapeutic monitoring. TDM, therapeutic dose monitoring, that is blood sample we give and measure the amount of drug in that. We do it for the drugs which have low therapeutic index and low therapeutic window. For these drugs we do TDM. For other drugs we do not do, right? We do not do, right? Have you got it? Say yes or no. Have you got it? Yes or no? So that is TDM is required for all these drugs. For all these drugs we require TDM. So let me revise you few things. So we are done with the four important parameters. So potency of the drug. What is the potency of the drug? It is the amount of drug which is required to produce a particular response. It is measured on x-axis and the rule says left side, more the left side is the drug, lefter is the drug, more potent it is. Efficacy is the maximum response the drug can produce, right? It is measured on y-axis and the rule says more is the height or more is the taller or more is the peak of the drug, more efficacious it is, right? Slope, there are two types of slope, flat slope and steep slope, right? The drugs which are having flat slope are safe and the drugs which are having steep slope are dangerous. So you should know the list of the drugs with flat and steep. The last is therapeutic index and therapeutic range. So therapeutic index ka formula LD50 upon ED50, right? Therapeutic range is the dose at which minimum therapeutic effect is there to the dose at which maximum acceptable side effect is there. The range between these two doses is therapeutic range. So you should know the formula of both of them. It is 50-50, it is minimum maximum. It is 50-50 ka ratio, it is minimum maximum ka range, not ratio. So I tried hard. Yeah, so I have given you the list of the drug which is having narrow therapeutic index and narrow therapeutic range. Both are having same list. So the mnemonic of the drug is a drug possessing low therapeutic index. You know the full form, right? So you have to do regular TDM for them. I am done. Give me a thumbs up. With this topic, I am done. Do you have any doubt in this? Anyone having any doubt in this? So you can compare the potency here. You can compare the efficacy here. Potency wise, if you see, left is the graph, more potent it is. So A followed by B followed by C. Left to right, right? Efficacy wise, A is equal to C. A is equal, both of them have same height, but it is more than B. B is shorter, right? So this is efficacy. Do you have any doubt? Anyone? So this is the two slopes. You can see this one is the flat slope, so a safe drug. You see the flat. And this one is the steep slope, so a dangerous drug. A steep one, dangerous drug. Give me a thumbs up. And the next is therapeutic index. So draw two DRC. This is therapeutic DRC. This is adverse effect DRC. Take 50-50. 50% here, 50% here. So LD50 upon ED50 is the formula of therapeutic index. And if you talk about therapeutic window, so again draw two graphs. Therapeutic effect and adverse effect. Here take minimum concentration which is acceptable. Here take maximum concentration which is acceptable. The range between the two. It is not 50-50. It is minimum on one graph and maximum on other graph. So this is known as therapeutic window. So I tried hard. The revision is also done. You want some polls? which are the previous year questions based on these concepts, based on DRC. It was a difficult concept. I tried hard. Okay. This is first question in front of you. Please read the question. You have to answer. You have to write your answer in the chat box. So please, I'm reading the question. What is potency of the drug? Read the four options. You tell me what is the potency of the drug. A, B, C, D is in front of you. So please write. Let me see if I can see your chat. What is potency of the drug? Who will tell me what is potency of the drug? What is potency of the drug? Who will tell me? Yes. So is it affinity of the drug to bind the receptor? It is affinity of the drug that binds to the receptor and activate it. Is it the dose that required to produce a particular response, or it is the maximum response produced by the drug? So Rishinika is right. Anyone else want to answer this? So Bablu, Iram, anyone? Yes. Kuldeep, Iram, you are also right. Anyone else? Yes. The correct answer is C. You all are right. It is the dose that required to produce a particular response. So C is the answer. Yes, proud, you are also right. Instead of potency, I'm changing the question. I'm asking the question efficacy. What is your answer now? Efficacy. From ABCD, the same options. What is your answer now? I have changed the question. Efficacy of a drug refers to. What is your answer now from ABCD? Who will tell me? Who will tell me? Yes, yes. So Rishinika, Kuldeep, yes, you all are right. Bablu, very good, very good. In this scenario, your answer will become D. It is the maximum response produced by the drug. So C, yes, Amreen, yes, very good. So you can see a little bit change in the question is changing your answer, right or not? So that is the thing. So potency, efficacy, versus here the response is C. The same question, I have already put this question. So response, efficacy, ka answer D hoga. So coming on the next question. No, it is a difficult question. Don't rush. Take your time. Take your time. I'm sorry. Graph is given to you. There are two drugs, X and Y. You can see the graph for both of them. This is the graph for X. This is the graph for Y. Now read the four statements which is true. Which statement is true between drug X and Y? You can see the graph. Of there are two drugs, the same drug. This is drug concentration. Log is not given, but consider it is logarithm because it is sigmoid. So sometimes logarithm nahi bhi likha hoga, so you consider it is there and response is there. So it is log DRC. So please read the four statement one by one and tell me what is correct. Who will tell me? Okay. Should I read the four statement for you? Who will tell me? Who will tell me? What is the correct answer? Anyone want to tell me the correct answer? I'm waiting for you to write your answer. Yes. So Kuldeep is right. Iram, you are wrong. Yes. Anyone else? Kuldeep, Iram. After that, anyone else want to try? Okay, listen. I will read it for you. One by one, we will study all the options. Okay. Okay. So first option is drug X is more efficacious than Y. Right? No, it is the reverse. Drug Y is more efficacious than X. You can see Y is taller and X is smaller. So Y is more efficacious. It is not X, it is Y. Right? Right. So this statement is wrong. Let me wrong it. Let me read D. Potency of X is less than Y. See X and Y. So who's the X is on the left side and Y is on the right side. So X is having more potency than Y. It is not this thing. So it is reverse is given. Potency of X is not less. It is more than Y. Right. And drug X is more nahi less efficacious. Right. So these both statements are reverse given. That's why these both are wrong. So Tanish, you are also wrong. So have you got it? Have you got it? So, okay, these two statements are wrong. Absorption has nothing to do in this graph. In this graph, there are four parameters to be studied. One is potency, one is efficacy, the third one is the slope, and fourth is therapeutic index and therapeutic window. You cannot comment on absorption based on this graph. This graph do not tell anything about the absorption. So, this statement is wrong. So this graph tells us four parameters. This graph do not tell us absorption. Absorption is none of the parameter. The four parameters are potency, efficacy, slope, and therapeutic index and window. These are the four parameters which has to be studied from this graph. From this graph, I cannot comment on absorption. Maybe absorption of X is more than Y. Maybe Y is more than X. I don't know. I don't know. My answer is I don't know about B. Whether this statement is right or wrong, I don't know. Because this graph doesn't tell us anything about the absorption. Let me come on option number C. What is option number C? Y achieve a high maximum effect than X. ये percentage नहीं है. It is X. ही गलती से type हुआ है. It is X. Y achieve a high maximum response than X. Now see now. So effect मतलब effectivity. Yes, so effectivity of Y is more than X now. It is taller. So this statement is right. So it was a little bit confusing question. Nothing else. But the question was not very difficult. You don't have to comment on absorption. You have to comment on 4 things only. So if I give any graph between 2 drugs, you have to comment, मैम potency किसका ज्यादा है, efficacy किसका ज्यादा है, slope wise कौन steep है, कौन flat है, और therapeutic index और window के लिए you know two curves, effectivity का भी और adverse effect का भी. Then you can comment कि therapeutic index is narrow or wide. So that you can comment. So based on that, you can answer it. Everyone give me a thumbs up. Everyone give me a thumbs up. So correct answer here is C. Okay. This is the next question in front of you. I guess the most easiest question. What is this formula for? LD50 upon ED50 is the formula of therapeutic index, or is it a formula of bioavailability? Is it a formula of potency, or is it a formula of efficacy? It is a very easy question. I guess everyone will be able to answer it. Yes. So everyone. Yes, Rishinika, absolutely right. Everyone is right. I guess everyone will be right. It is an easy question, not to launch yet. Yes, it is a formula for therapeutic index. So what is LD50 here? LD50 is the lethal dose 50. And what is ED50? It is the effective dose 50. You all are right. Very good. So correct answer here is A. It was an easy question. The next question, please read down. It is a little bit difficult, right? If you know the mnemonic, you can answer it. Narrow therapeutic index is seen which drug? Which drug? I have given you a list of drugs which have narrow therapeutic index, which are dangerous drugs. For these drugs, we have to do TDM, therapeutic dose monitoring. So they have narrow therapeutic index. What was the mnemonic? A drug possess low therapeutic index. A drug possess low therapeutic index. So you know the full form. If you know the full form, you can answer it. If you know what is L here, who will tell me L is lithium. L is lithium. Yes. So correct answer here is lithium. You all are right. You all are right. You all are right. Right. You should know the full form of it. You should know. It is aminoglycosides. It is the digitalis, digoxin or digitalis, phenytoin, lithium. What was T? T से क्या था? I just forgot. I say immunomodulator. What was T? I just forgot. Anyone? T से क्या था? I say immunomodulator है. I say immunomodulator है. T से anyone remembering? Please write down. Otherwise, I have to go back. Anyone? What was their T? I forgot. Okay, I will go back and let you know. T से है tricyclic antidepressants. Yes, very good, Rishinika. It is TCA. Yes, T से tricyclic antidepressants. Very good. So let me come on the next question. Here the answer is lithium, right? Here the answer is lithium because only lithium is coming in that mnemonic, right? So correct answer is lithium. Here a drug possessing low therapeutic index में you can get confused with the D. There are two D वाले options भी हैं, but this D is digitalis. It is not desperamine. It is not diazepam. It is digitalis. So you should not get confused. P is also there. It is not penicillin. It is phenytoin. It is phenytoin. So this option is incorrect. But yeah, L is lithium. L is. So it is not the mnemonic you should know. It is the full form of mnemonic which matters, right? So correct answer is this. Okay. Which of the following is true? Which statement is true? Now it is a difficult question. Read the 4 options very calmly and tell me which statement is true. Which of the following statement is true among the 4 following statements? Please read down. I will give you few seconds. I will give you 15 seconds to answer. Please write down your answer in the chat box. Kuldeep, Prishinika, Iram, Tanish, Bhavna, Bablu, Proud Indian, Amreen, everyone. Please participate. Tell me your overview. What is view? What is your view on this question? It's an easy question, not very difficult. I want you to participate. Let me see your chat. Okay, I can see it. Yes. Which of the following is always true? You tell me what is correct. Should I read the options for you? Which statement is correct? Yes. So, okay, most of you are right. Proud Indian, Imran, Rishinika, Kuldeep, Bhavna, very good, very good. So, correct answer here is D. Okay, let me read the question. A more potent drug is more efficacious? No, it is not always true. Maybe a more potent drug can be less efficacious. No, it is not always true. A more potent drug is safer? No, safety is not related to potency. Safety is related to therapeutic index and therapeutic window. It is not related to potency and efficacy. No, it is related to the slope, and safety is related to therapeutic index and window. No, so this statement is not true. A more potent drug is clinically superior? No, clinically we see the efficacy, not potency. So if there are 2 drugs, A is more potent than B and B is more efficacious than A, so we select effectivity is a clinical criteria to select the drug. So this statement is also incorrect. But C is statement number 4. What is statement number 4? D. A more potent drug can produce the same response at a lower dose. This is the definition of potency. So a drug which is producing the same response at a lower dose is more potent. There are 2 drugs, drug A and B. Drug A at 10 milligram produces 90% of the response, and drug B the same 90% of the response is produced by drug B also, but at 40 milligram. So who is more potent? The drug which is required at low concentration to produce a particular response is more potent as compared to other drugs. So yes, D is right. So correct statement is D. You all are right. Everyone give me a thumbs up. So this is how you have to approach the question. This is next question in front of you. Who will tell me the correct answer? Higher efficacy of a drug necessarily confers. What do you mean by that? Higher efficacy का मतलब क्या होता है? Higher efficacy. I'm asking about efficacy. Is it greater safety? Is it therapeutic superiority? Is it capability to produce more intense response? Or is it cost saving? Higher efficacy का meaning क्या है? Again, it is a confusing question. All these are previous year questions of various exams. These are not the new question. These are the repeat ones. You should know the answer. So Rishinika is saying C. Anyone else? Higher efficacy मतलब क्या होता है? Is it cost saving? Is it greater safety? Is it therapeutic superiority or capacity to produce intense response? Yes. So Rishinika, Imra, Kuldeep, you all are right. The correct answer here is capacity to produce more intense. It is the response. Response produced by the drug is the efficacy, right? So higher efficacy means intense response. So Iram, you are also right, not right exactly. You are saying B. So you should have an argument, ma'am. Why not B? You told us that among the potency and among the efficacy, clinically efficacy is a superior criteria to select the drug as compared to potency. So if I'm having two drug, A is more potent than B, and among the same drug, B is more efficacious than A. So you told us that select B instead of A because efficacy is a good criteria. So why not you are saying therapeutic superiority? But it is not the only criteria. I will take comorbidities also. I will take other criteria also. So it is not the only criteria which I take therapeutically to select the drug. So that's why Iram, this option is not correct. If C was not given, I will go with B, right? I'm not saying B is absolutely wrong, but it is not absolutely right also. So you're not completely wrong, but yeah, if C is given, go with C. C is more firm answer, straightforward answer as compared to B. Everyone give me a thumbs up if you got my concept. Iram, have you got it? Okay, so I'm done here. So next is combined effect of the drugs, synergism and antagonism. What is agonist, antagonist, partial agonist? There are many terminologies you have to study and compare the DRC of various. Compare the DRCs of agonist, compare the DRCs of antagonist, competitive antagonist, non-competitive antagonist. So you have to compare. Now this is a difficult topic, somewhat difficult topic to be understand here, somewhat difficult topic. But the time is limiting, so I will take this chapter tomorrow, and not only this chapter. Let me show you after in pharma. I'm having the next lecture of pathology. Don't go anywhere. Pharma we will continue tomorrow. So here I have to teach you the receptors also. The various types of receptors that is known as transduction mechanism. So it is a very difficult portion and no one will teach you this portion. The 5 type of receptors, that is G protein coupled receptor, intrinsic ion, JAK-STAT, tyrosine kinase, and receptor regulating the intranuclear transmission. So you have to understand these 5 mechanism of the receptor, the most difficult topic of the entire pharmacology I found out. This is the most difficult topic, not only of this chapter, of the entire pharmacology. This is the most difficult topic I found out, and students also find out. So I'm planning to take this lecture, transducer mechanism. Maybe soon I will schedule it, but tomorrow I'm continuing the pharma. And yeah, there are few important announcements for you. Just after a break of 10 minutes, I'm having my next lecture. The next lecture is of pathology. Just a second. Let me announce my next lecture after 10 minutes. Then you people can go. Thank you very much for being with me for this lecture. Don't forget to write your feedback in the comment box for this lecture. Do you find it useful? Yes or no? Next class is after 10 minutes. That is at 12 p.m. sharp today, just after 10 minutes. Not on Let's Crack NEET PG YouTube channel. It is on another YouTube channel. It is on YouTube only, but another YouTube channel of Unacademy. That is UA Live, Unacademy Live. Unacademy Live YouTube channel. It is another YouTube channel of Unacademy only. So Unacademy is having many YouTube channels. So this is Let's Crack NEET PG on which you are watching right now. So go on another YouTube channel of Unacademy, that is UA Live, Unacademy Live. I'm sorry. UA Live, and please watch my next lecture of pathology on it. The topic is hepatitis. I am going to super simplify the hepatitis for you. Not only this, from 12 to 1 I will take the lecture for 1 hour. For 1 hour. Sharp at 1 we will connect with each other on open house. I will share 2 links with you. The first link of YouTube and the second link is of open house. So YouTube, you can see me, you can hear me. But on open house, I can hear you. I cannot see you, but I can hear you. So anyone want to talk with me directly, I can hear your voice, I can hear your doubts. So ask your doubts directly in open house. Instead of writing in the chat, you can ask your doubts directly in the open house. We all can have an open discussion like a classroom discussion. So at 12 p.m., I'm having hepatitis lecture on YouTube, on UA Live. And after 12, 1 hour, at 1 p.m. I'm having an open house just for 10 minutes, 10 minutes or 15 minutes open house. So we will, it is an audio room as I have told you. So after that, there are few more announcements. As you know, please participate in All India mock test, which is going to happen on 26th February at 9 a.m. So all the aspirants of NEET PG 2022 should give this mock test. The pattern of the questions is same as that of main exam, right? NEET PG notes, yes, the hard copy of the notes are coming and anyone can order it and take it. It is a very reasonable price, right? NEET PG notes are coming. You should participate in the combat test if you want to win the Amazon gift vouchers, right? So the first 10 lucky participants will be given the Amazon gift vouchers. The subjects are these: ortho, OBG, surgery, and pediatrics. It is going to happen on 19 February, 6 p.m. So you should participate in that. So till 19 Feb, you have a great offer to grab. If you want to take plus or iconic subscription, any subscription, instead of 10% discount, which you usually get, you are getting 20% discount if you are taking the subscription before 19 Feb midnight. So if you apply my code, you will get it. So what is my code? My code is Sachdev10. SACHDEV Sachdev10. So please distribute this code to all medicos you know and grab this opportunity if you wish. So you can see the two type of subscription. Once you take the subscription, you will be eligible for all these batches and you can see how much you are saving by taking this subscription. So this is the usual plus price. This is the plus price we are offering till 19th Feb. So these are the savings. These are the usual iconic price. These are the iconic price we are offering till 19 Feb. So these are your savings. So whatever plan you want, you can take. The only thing you have to apply my code Sachdev10 for getting this opportunity. SACHDEV Sachdev10 is the code for both of these opportunity. Thank you very much. Yes, the link of the next lecture, Bhavna, I'm putting on the WhatsApp, Telegram, everywhere where you are connected with me. Please connect. And Bhavna, if you don't find the link, go directly on UA Live YouTube channel, and you will find my lecture live in the next 10 minutes, right? And link of open house, I will pin in the chat of this next lecture. So after that, we have an open house also. Thank you very much. I'm ending this lecture. I want everyone to be back after 10 minutes on